Placement is one of the most rewarding parts of training to be a nurse, but let's be honest, it's also one of the most stressful. You're learning new skills, you're adapting to different wards, you're working long shifts, and somehow trying to stay on top of assignments and revision at the same time. Worrying about failing placement is normal. There are usually early warning signs that things aren't going as smoothly as they should, and when you spot them early, you can almost always turn things around with the right support. Hello, you're on Shift with Sian, the platform that empowers student nurses with the knowledge, tools and support to build confidence in practice. In this video today, I'm going to walk you through what the red flags look like so you can look out for them, what failing placement actually looks like in real life, and most importantly, what you can do to get back on track. An early warning sign then that you might be struggling is if you're hearing the same feedback again and again. Now, feedback is a normal part of learning, but when you're hearing the same comments keep coming up shift after shift, it's usually a sign that something needs adjusting. If you're hearing, try to be more proactive, or you need to communicate more confidently, work on your organisation, or take more initiative with patient care. At first, this can feel really vague and frustrating, and you might think, but I am trying. What your mentor is actually doing is highlighting a pattern, so you know where to focus your efforts. Ask for examples. What would being more proactive look like on this busy shift? Then you can make one small change each time you're on shift. Something as simple as, if you know medication rounds at 12 o'clock, you can start preparing for it 5 minutes early. Go and get the sharp sparks, refill the medication pots. Those tiny actions show awareness, organisation and initiative, and they do get noticed. The second sign then is that you're hesitant to ask questions or to speak up. This one is so common with student nurses. A lot of students worry about looking silly, slowing the team down or being annoying, so instead of asking for help, they stay quiet. And this can look like guessing how to do tasks, watching instead of getting involved, not clarifying instructions, and avoiding skills that you're unsure about altogether. Assessors would much rather you ask 10 questions than make one unsafe decision. Some really simple phrases that can help are, can I double check this with you? Or, I haven't done this before, can you guide me? Or, I just want to make sure I'm doing this safely. The more you ask and realise that people are happy to help you, the easier it becomes to speak up, even with those more complex skills. Another early warning sign then is that your learning outcomes are falling behind. Now let's talk about that placement record. The bit that everybody hates. After a 12-hour shift, the last thing you want to do is start doing reflections or chasing signatures, and most students don't schedule time to do this properly. Warning signs include your outcomes not being signed off, leaving everything until the final weeks, rushed reflections, or not being sure what competencies you've still yet to do. This can quickly become overwhelming, and a really simple fix to this is that at the start of the week, look at your outcomes and pick 3 things to focus on. Then ask your mentor, what opportunities can I use this week to meet these 3? It keeps those skills fresh in your mind. It also helps your assessor to give you the right exposure, and it stops that horrible last-minute panic. So small, steady progress always wins. Just a quick pause to share something that I have made for student nurses, and it is my Nursing Wellbeing Journal. You are completing one of the most demanding courses there is out there, and feeling overwhelmed, burnt out, or like you're constantly on empty. It's usually your wellbeing that gets forgotten first. This Nursing Wellbeing Journal has weekly and monthly check-ins to help you reflect on your stress, energy levels and your self-care. There's space for you to record the positives, prompts to reset each week, and a full year of journaling in one book. It's exclusively available on my website, shiftwithsian.co.uk. I'll leave the link in the description. Remember, you can't keep pouring from that empty teapot. Your well-being matters. Next is if you still feel like you're an outsider on the ward. Now, feeling awkward at first is completely normal, but if weeks go by and you still feel disconnected from the team, it can start to affect your confidence and your learning. You might notice that staff don't involve you much, you're observing more than you're doing, you don't feel trusted with tasks, and you feel like you're just in the way. Most of the time it isn't personal. Busy wards move fast and student nurses who stay quiet can accidentally fade into the background. Now, the key is to making yourself visible in a positive way. So introduce yourself to everybody each shift. Ask what help is needed and volunteer for basic care. Show interest in patients. A tip is to find somebody to shadow. A healthcare assistant is perfect for this. They know the routine, the pace and the team, and they can help bring you into things naturally. The next warning sign is when somebody has raised a concern about your progress. Now, this is the one that scares student nurses the most, but it's actually meant to help you, not to punish you. And it might sound like we need to talk about your development, or there's a few concerns that we should address, or let's put an action plan in place. This does not mean that you're about to fail. It usually means that somebody cares enough to step in early and support you. The most important things that you can ask for are clear goals, written expectations, and regular feedback. When students get this support early, most go on to pass comfortably. How to actively avoid failing placement then. So let's talk about the habits that help massively in improving your chances of success. Number one is to be proactive from the start. Don't wait for feedback, ask for it. Questions like, is there anything I should improve on this week, or what should I focus on next week? This gives you direction, especially when you're tired and overwhelmed. Use reflection properly, and not just as a tick box exercise, but use it as learning. After a difficult shift, ask yourself what went well, what challenged me, and what can I do differently next time. You can write it anywhere in your notes app, your journal, or a Word document. It doesn't have to be fancy. Reflection can really help you grow in those areas that you identify need improving. Communicate when you're struggling. Struggling doesn't mean you're weak, but staying quiet makes it much harder. So whether it's your confidence, anxiety, the workload, or skills you don't understand, speak up early. There are so many people whose job it is to literally just support you. Your assessor, your personal tutor, practice teams, student support services, or even fellow students. It takes courage, but it's absolutely worth it. If you do fail placement, what actually happens? Now, this is rarely sudden. No one fails out of the blue. Usually it goes through stages: early concerns, support plans, and review periods. Early concerns are conversations about what you need to improve and how your supervisor or assessor can support you to do that. If progress isn't happening, an action plan can be put in place. Now, this is not a punishment. It's a structured support system with goals and regular check-ins. Only if things don't improve after that does failure happen. And even then, most universities offer retrieval or repeat placement hours period. If you're worried about failing placement, that usually means you care, and students who care can always improve. So spot the signs early, ask for help, and take small steps forward. You're far more capable than you think. If this has helped, click like and subscribe and share it with somebody who needs this reassurance right now. Be kind to yourself, we've got this.